This is my ISC 450 course project. My name is Stephanie Brown, and I did my course project on dispense and e-pharmacy system. The system is fairly easy, and this is just the beginning of an e-pharmacy system. Just trying to show you, get the idea of how it kind of all works and to make the system. Dr. Dillon orders a prescription to Ocean Springs Pharmacy by e-prescription. Patient goes to Ocean Springs Pharmacy. Well, then the pharmacy e-prescription goes to the computer. So it's now into the pharmacy's prescription system. Here is Ocean Springs Hospital Pharmacy. It's their e-pharmacy system that they have. You can go straight up to the very left-hand top corner, which is patient search, or you can enter into demographics, where you would search for demographics for different patients. Income and faxes, which is usually for pharmacies. We also have RX numbers, where you can just go in, type in the RX number, and it would bring up a patient. Reports, and you also have insurance, where you go and look at the different insurances maybe the patients have. Also, over here in your right-hand corner, you have received e-prescriptions. These are prescriptions that come from your doctor's offices, your hospitals, such as in this setting, which is the hospital, would come from the doctors or the that are inpatient or outpatient. Then we have refill requests, error in prescriptions, maybe something such as I didn't have how many times they're supposed to take it a day, or didn't have the amount of refills they could prescribe. Need authorization, and that's those prescriptions that either need to be authorized by the pharmacy. The pharmacy needs to be authorized, such as insurance company or their doctor's offices or things like that. And then finished prescriptions are the prescriptions they've finished for the day. They can go back and see how many prescriptions they had filled, or if they have a question about one, they can always come back to that and be able to look it up. And the next one is we went in, we entered in the patient search Taylor Smith. Or like I said before, you could go to received prescriptions, and you could also pull it up that way. As we see here, Dr. Dillon sent in a prescription order for Nexium. He requested the dose, the route, duration, refills, brand name, yes, and he also included special instructions such as take 30 minutes before meals. Also on this slide you can see he also has medication allergies, which Ms. Smith is allergic to iodine. So once we reviewed over this, we'll click it as received down the bottom right hand corner. Once we click that as received, we'll need to then go into the patient demographics. So we can go into patient search. From there we can see the patient information, such as the patient's name, gender, date of birth, age, and their phone number, and also a list of their pharmacies. Also here it lists the thing of their allergies. She is allergic to iodine and wasp. Medical history, she doesn't have, medication history, she doesn't have any. So after review the patient information, we'll click save and then exit, which brings us to our next screen of selecting the prescription. We then make sure we have Ms. Taylor Smith. Is it currently active? Yes. Starting date April 1st, 2013, and we'd go to the database, find Nexium, click on Nexium, and it would put it into the drug listing. Availability is yes. substitution? No, because Nexium does not have a generic medication for it. There's other medications out there that's like it, but there's no generic brand. And as you see here, it also again lists her medication allergies. Some of this already comes input into the system because you've already had it one time, so you don't want to have to keep repeating that step. You want to try to keep it as much information that you can already in the system without having to go in and select a different option each time or repeat putting in information. So then we'll click next. From there we get to formality, which is where we need to see if the patient's eligible with their insurance company to receive Nexium. They stated it was approved. Formulary status is approved. And the patient drug tier, which then would come down here and we'll see that as highlighted in the blue, that the copay for Nexium is $20 because it's non-preferred. With some insurance company, once you send out the formulary, they'll come back and tell you whether it's non-preferred, preferred, or generic. Most of the time, they prefer you to start with a generic prescription or a preferred, but really not most of the time non-preferred. They'd rather make you work up that tier ladder to the most expensive medication, so sometimes they don't have to come in and cover as much. But if the doctor orders that and they do the correct paperwork to get it authorized, they will be able to have the prescription of Nexium. We'd come down here, click next, which would bring us to selecting a dose for of Nexium. Dr. Dillon, he ordered Nexium 20 milligrams, so it'd come in here and select 20 milligrams. Nexium only usually comes in 20 milligrams and 40 milligrams. So most of the time we only have 2 to choose from, especially with this type of prescription. And since that information was already entered in previously, such as duration, quality, and frequency, we don't have to worry about inputting that. But once we come down here, we'll make sure that we have to input the refills. So we do the drop down arrow, make sure we put as many refills. Do the special instructions, take 30 minutes before meals. So then we would go to finished, which would then bring us to the next formulary where they would come in and see if they approve the duration limit, which Dr. Dillon said NA, and then inventory for the pharmacy, it's in stock. Alternatives, they wanted to do an alternative of Dexalent. But since the patient had already tried Dexalent, the Nexium had gotten approved for the patient, so we didn't have to put him on a preferred medicine instead of, we didn't have to put him on a preferred medicine. We could put on Nexium. Next here we got the pharmacy checklist, which can be one of the most important parts of dispensing the medication, because you want to make sure that you have the right patient and giving the patient also the right medication. It's very important. And with this checklist, it's pretty easy. You can come in, some would like to initial beside them, but we decided to do X marks and just click them off as you go, because once you log into the system, you're already logged in under your username. So unless somebody comes by and uses your name, it all falls back onto you. So we just kind of use this as a little checklist to check off that you have the right patient, Taylor Smith. We'll check mark that off. And the right drug, which is the Nexium that Dr. Dillon prescribed. Check mark that. And the right route, which is by mouth. Check it off. Right dose, 20 milligrams, twice a day. Make sure you got that. And the right timing, which is twice daily, 30 minutes before meals. Check off. By doing this, it gives you a second chance to review back over what you did to make sure you have the right patient and gave them the right drug, because You just never know. You just got to make sure you go through these 5 rights and check them off as you go. Or we can change it to where you could initial off on it as you go. But this is the way we have set up this type of system here. Once we have all the 5 patients right, we then hit complete. Once it is completed, it would go into the finished prescriptions and stay there for approximately about 6 months or so, just depending, just so that we have a referral to look back at in case anything ever happened or came up. But this right here concludes my system on dispense and pharmacy. Thank you.